So, welcome to the seventh module, this seventh week course on human resource development, and here we are going to discuss about a very important issue that is also a kind of HRD intervention, and this is known as counseling. Okay. You know that sometimes people have performance related problem, and the solution is not coaching, mentoring or what you call training, because so far as knowledge and skill base is concerned, they have all the requisite knowledge and skill base, but somehow they lack motivation, interest, basically they are derailed or detract. So, it is not possible them for to perform well, and there are certain other issues, mental health issues, psychological health issues, they are not able to feel well at the workplace, right, and that is where counseling comes into the picture. And you know that today workplace counseling is very common. Many organizations have structured counseling programs, or they refer their employees who are not having who are having certain problems, right, to the counselor, so that they could be advised what to do and how they can be brought back to the track, so that they are able to perform well. See, it is also related to managing performance, but the approach is different, because here the training is not a solution, okay, because the person has all the knowledge and skill, but probably he is not ready to use that to perform well, he does not have the motivation and interest to do the job. Okay. So, what needs to be done? How to brought him back to the track? Okay. I give example that we might have students who are very good, very talented, but they are not able to perform well. The reason? Because they have deviated themselves from the track. Okay. They might be doing something else which is going to be of interest to them. They might have deviated from the track, and they have been doing certain things which may not be good. There could be problems related to adjustments, coping, stress, mental health, and all kind of issues at the workplace may be there. Okay. So, what we can do is that we need to plan certain interventions, okay, and we are using the same process, because and that is why we are treating it as HRD intervention, that we need to identify who need to be counseled based on the performance or other related problems. Then we also need to see that what kind of counseling can be done for him, who is going to do it, okay, how the counseling program will be delivered, and then ultimately how we are going to evaluate workplace counseling to see that this program is effective. Okay. So, these are several issues that we are going to look into now in this module, what is known as employee counseling and well-being, right, at the workplace. And to start with, the first session basically is devoted to make you understand about the basic concepts of employee counseling. Now, if you look this figure, it shows that you can overcome those problems related to anything that you have in your life, which is going to affect your performance at the workplace. Okay. But before we go about it, we must understand certain basic concepts related to what you call employee counseling. Look at this picture first. The puzzle is showing certain words which are very important. Okay. Depression, disorder, mental health, stress. Okay. If these are the issues, probably you need to think about counseling. The employee need to be counseled, so that they are able to come back to the track to perform well. Okay. But the most important thing is that you should be able to identify such people who are going through these kind of problems, so that they could be taken care, right. You know that a lot of people commit suicides due to high depression, okay. But an early intervention can save them, provided you are able to identify that this person is going through severe depressions, right, and help him to overcome these kind of issues, both psychologically and also through medication they can be helped out, right, and that is where counselors come to a great aid, and that is why counseling is required, especially in case of employees at the workplace. So, there are certain questions that I am going to start with, like, have you ever seen people at workplace struggling due to high anxiety? Yeah, that is possible. You might have seen people having very high level of anxiety, and which is affecting their performance. The performance has deteriorated, the quality has gone down, they do not speak to others, they do not get into good relationship with people at the workplace. So, all kind of problems may happen provided they are having high level of anxiety. Okay. And refusing treatment for a treatable conditions. The basic problem with counseling is that it is very difficult to identify who has a problem, because unless the person himself is not able to recognize or understand that he has a problem, nothing can be done. Okay. And in these cases, probably they do not think that it is appropriate for them to go for some kind of treatment if there is any mental health related issues, because there is certain stigma that is attached to it. They think that you are a different kind of person, and that is why they do not try to even recognize that they have a problem. And that is where even HRD professionals have a role to play with the help of the counselors to identify such people and make them realize that yes, they have a problem which can be treated very effectively and they can be brought back to the mainstream. Right. Third thing, have you experienced job burnout, feel exaggerated, okay, and all kind of things? That is what job burnout means, that you feel helpless sometimes at the workplace, you think that you are good for nothing, okay, and that it could be a result of stress also, because stress leads to job burnout. So, if you are feeling these kind of things, probably yes, you need to be counseled very well, so that you can come out of this and overcome these problems. Okay. So, the role of the HRD professionals is to ensure that they are going to be involved in, to see that people are not going to have these kind of problems. So, what they are supposed to do is that they need to make effort to ensure that these kind of mental health issues does not arise, and if it arises, it is taken care. People are able to realize that they have a problem, so that they could be treated, and they also need to identify such people who are having these kind of problems, right, and that is why you need to go for counseling. Look at this picture. What does this show? Someone is sinking, not in physical terms he is sinking, but he is going down physically, mentally, especially mentally. So, if it is mentally going down, you need to extend an help to help him to come out of this situation, right. So, the idea of counseling is to help this person, to extend help, so that he does not die in the ocean of depression, stress, anxiety and this kind of thing. So, it is very, very important to bring him back to life, so that he can also enjoy and work effectively. And that is where you have to make them understand certain things, that is personal problems are part of life. See, have you ever seen a person who does not have a problem, including yourself? Think about it. Yes, we all have some problems, we all have our own anxiety, stress and depressions in life, right. But it does not mean that we are so much overwhelmed by or so much overpowered by these kind of things that it is going to affect us and results in bad performance, right. See, problems may be part of life. So, you have to take in that way, in a positive spirit, that yes, we are having problems and we need to sort it out, right, because each one of us have some problems. Somebody might have it to lesser extent, somebody might be having to a greater extent, but it is correct that we all have problems in our life. It could be related to profession, it could be related to relationship, it could be related to family, it could be related to health. So, we have all kind of problems, right, in our life. Second issue. So, these problems are going to affect our performance on the job. Similarly, if you look at the healthcare cost, this is going to increase. So, if you are able to reduce this, probably your healthcare cost would go down. Say for example, if you are going through a phase of high anxiety, depression or stress, probably it will have certain physiological impact. Your blood pressure, your sugar level will go up, and that requires physical treatment, which would be a cost for you, right. Whether you are going to bear it or your organization is going to bear it, but since increasing cost, you need to maintain a good balance of good physical as well as mental health for effective performance. And if you are energetic, if you are good, having good physical and mental health, probably it is going to help you to reduce your tardiness. You are not going to keep you absent, you are not going to lose time, and you are going to save compensation on these kind of things. And that is why implying organizations today are spending a lot of money, billions of dollars of money you can say are being sent on these kind of programs to save employees, so that they come out of distress and lead an effective life and perform well. And it also helps in improving what you call productivity, reducing employee turnover, okay, and impacting the performance of the organization. And that is why it is not that you are doing this just for the sake of helping the person, but you are doing it because the person has certain problems which is affecting his performance. So, ultimately you try to link it with performance, and that is why you are considering counseling as a HRD function are important. Okay. So, the most important thing is that you need to address employee well-being, because it has certain positive impacts on the performance. So, suppose the person is having certain anxiety, stress or these kind of things, okay. You go to a counselor and then he will try to help you with this to see that how this problem can be addressed. And here you can see the counselor trying to counsel a person who might be having certain problems. Okay. The idea is that if you are able to take care of employee well-being, it is going to increase morale and motivation of the employees, right. It is going to reduce the impact of external factors, because this stress anxiety may not be internally, but it could be related to family, health, personal related problems, which is going to impact his performance, right. So, you need to counsel him on these aspects also, and it is going to help you to improve the productivity, right. So, it is better to treat, train and retain existing workers than to hire new people, because you know that if you are going to fire him, the replacement cost may be high, because the person has all the requisite knowledge and skill base to perform well, but he is being detracted, he is performing certain behavior which is not desirable, and the reason could be certain mental health problems, certain disorders or something like that. So, it is better to counsel him, treat him, so that he can work effectively instead of going for hiring a new worker, because that is going to increase your cost, replacement cost. To recruit, train and develop person to that level will be a very expensive affair, and that is why it is important to address issues related to mental health in the organizations. And that is why we treat counseling as an HRD function, right, where you are going to use the same HRD process to meet the objectives or goals of either improving or maintaining the performance of the employees who is detract or who is deviated from and doing something else because of certain mental health issues. Okay. And you are going to use the same techniques as you have used in coaching or mentoring or in training. So, you need to analyze who is to be assessed in terms of counseling. Then at the next stage you are going to design and develop a counseling program. You have to hire a counselor based on the problems. He is going to design certain intervention, he is going to use certain tools and techniques for counseling, and then later on you are going to see that how it is going to impact the individual, okay, and whether he gets back to the track, and then whether he is able to improve or maintain his performance or not. And that is why we are treating this as a HRD function. And here also we go for the same kind of analysis and planning as we have done for other HRD intervention. Now, look at the counseling program as such. First of all, what we do? We go for problem identification. What do you mean by problem identification? In problem identification, basically we try to see what is the problem of the individual, right. Then at the next stage what we do? We try to educate that individual, whether that person understands or become aware that he has a problem, okay. And then you can also educate through media, through communications, through other sources. Okay, these are the problems which might be there and which comes under mental health issues, and if you are having these kind of problems, you can come forward to get yourself treated. Then Then finally, you go for counseling. Through a process, you select a counselor and he is going to devise certain tools and techniques through which you are going to be helped to see that you are able to overcome this problem. And then you need to be referred, if counseling is not a solution, probably if you have severe mental disorders, then you need to be referred to somebody else who is going to be a what you call a psychiatrist. Okay. In case of severe mental disorders, you need to be referred to a psychiatrist who is going to take care of your problem, and then he is going to give certain medications also for treatment, because counselors do not give medicines, they try to use certain therapies which to help you to come out of this problem. And then treatment happens, whether it is through counselings or through referrals, then you go through the treatment process and finally, it is followed up. Okay. So that you are able to lead a normal life and then results, and then you are able to perform your work effectively. So, these are the different stages what you call the counseling process. So, at the first stage we go about problem identification. So, when you are going for problem identification, you are using certain screening devices, right, and screening devices means that you are going to see whether his behavior is deviating from the normal behavior or not. That is the first indicator. Okay. So, for that what you can do, you can look at his absenteeism records, you can ask supervisors about his behavior, whether he is behaving in a normal way or not, or he finds certain issues with the individual, personal or professionals. Okay. He could be referred by somebody else, through referrals also you can find out, maybe from family or friends or others who could refer to them that yes, this person might be having certain problems. Okay. And then the person himself realizes that he has a problem, and then he comes out and participates in the process. And he said that yes, I think that this is going too much, I am feeling extremely depressed. So, I need some kind of help, and that is where the HR professionals try to design, develop some kind of interventions with the help of a counselor to solve these kind of problems. Look at this picture. How you go about identifying people who need counseling? Okay. Now, if you look this figure, it appears that he has some kind of problem. Okay. Though it is not identified that what problems he has, he is having his hand on the head, he might be feeling depressed, I might be anxious or maybe under stress, but it is not known what the problem is, and there could be different reasons for this problem. It is because his performance is not good, it is because his supervisor might have scolded it, maybe he is not keeping good record of health, or he may be having certain personal issues related to the family, the children, or could be marital in nature. So, it is called personal problems, right. Absenteeism, that is a result of certain things, maybe he is having stress which is resulting in absenteeism. So, he is not regular on the job, burnout, he is stressed out, okay, because the stress he has lost interest, motivation, all kind of things, or he is having anxiety and depression. Okay. So, there could be a number of problems related to the individual. So, when you are going to identify people who need counseling, you need to ensure that people are able to identify these kind of things. Okay. And in the process, it is the responsibility of the HRD manager to ensure that he helps out with the help of observations or other things, as we have discussed just now, that how to go about identifying the problem. Okay. The nature of problem could vary, right. So, what is important is that you need to identify what kind of problem it is, which is affecting actually his performance, and that is why if you look at it, it is here performance related problem, and this could be related to any of these things, or it could be an outcome of these kind of things. Okay. So, you have as a HRD professional, it is your responsibility to see or identify it, that what kind of problem he has and why he has this kind of problem. Okay. So, and that is where he is going to ask the individual or his supervisors, or if he is referred by the family or friends or other sources, to come to know that yes, he has a problem, because unless the person is convinced and realizes that he has a problem, no treatment or nothing can be done about the individual to improve his behavior and performance. and that is the first stage. And as you know that most cases people refuse to recognize that they have problem, and thus this creates a major hurdle, you can say, a drawback in the entire process of doing it. Then second aspect is education for awareness, right, that is equally important, because how do you make them understand that they have a problem? Okay. As I told you that recognition of having a problem is very, very important, that unless I recognize that yes, I have a problem which needs treatment, nothing can be done, right. Even if I have a physical ailment, so it will show in to me, and there are certain you can say symptoms that will show, right. So, I will go to a doctor to say, but in most cases if you have a mental health problem, you fail to recognize it. There could be certain symptoms, but since you are not aware what are the symptoms which are creating this kind of problem, which is affecting your performance, you are not aware about it. So, you need to be educated, okay, if you are having these symptoms, then you must go and see a counselor. For example, you might see advertisement that if you have these problems, okay, for example, if you have excessive thirst, if you go for excessive urination, if you are having these kind of problems, then you might feel diabetes, you might be having diabetes, and then you go for testing your diabetic level, blood sugar level, whether you have a diabetic or not. Similarly, if you have a mental health issues, then again you can go for treatment, provided you understand and become aware that yes, you have a problem which needs treatment. Okay. So, recognition is very, very important, and that is why you need to be aware that yes, you have a problem. Okay. So, this can be done through pamphlets, you can distribute, okay, whether you are having these symptoms or signs. You can show videos of people having these kind of problems at the workplace, and so that you can compare yourself whether you are having these kind of problems or not. Similarly, you can also give lectures, okay, what kind of problems people might face at the workplace related to anxiety, depression, stress, or even in case of severe mental disorders, which is going to affect your performance. Or sometimes you know that lot of unsolicited advice you get from different sources like TV, radio and other media, and they tell you okay, if you have a problem, please go and see a doctor or a counselor for your treatment, because it is not that something which cannot be treated. It can be treated and you can lead a normal life, right. So, there could be radio programs, there could be sponsored TV programs on these kind of things, which basically highlights mental health issues, okay, which can be looked into. Okay. So, there are lot of avenues and sources through which you can get information about what are the various mental health issues, okay, and what are the symptoms and how to go about recognizing it. And if this kind of education programs are delivered, probably it helps in making employees or workers aware, okay, that if they have these kind of problems, they should go and see a counselor, right. Apart from education, you should go for, then the counseling happens. The idea of counseling to ease the pressure, right. There was a study in 2010 by MacLeod, and he says that research evidence showed that workplace counseling interventions have been found to reduce sickness, absence rates in organizations by as much as 50%. Okay. This is a research study which suggests that if these kind of interventions are planned and employees are counseled, then the pressure is going to be much less. So, the idea is to reduce the pressures related to anxiety, depression, stress and other problems, and that helps the organization. Because if you look at the even from the return of investment perspective, it actually is cost effective for the organization to help these people to come out, and they are going to save a lot of money, right. So, this is how the counseling process takes place. So, so the next stage is that you are going to identify who is going to be the counselor. Okay. So, you have to identify a counselor either from within the organization or from outside who is going to take up this job. Okay. And the person needs a non-threatening person with whom he can confide, with whom you can talk, okay. You can discuss your problems. Okay. It could be a supervisor, it could be somebody else appointed by the organization like an ombudsman, it could be a counselor from the HRD department, or even you can see a professional counselor, and then he is going to carry out the counseling process. Referral, the fourth stage. In this stage, what actually happens? You are going to direct employees to appropriate source for assistance, depending upon the kind of problems he has. Okay. like if you can refer him to a physician or a psychiatrist, you can refer him to a substance abuse treatment centers for rehabilitation. If he is having a personal family related problems, you can refer him to a marriage counselors, because there could be different kind of counselors, starting with the school counselors in educational setting, okay. Then workplace counselors, they could be for personal problems, you have marriage counselors, you can have a health counselors, you have different kind of counselors who specialize in their job, okay. And depending upon the require, you can send him to them, okay. Like for alcoholics, you can go to a rehabilitation center, okay. Other options you have depending upon the requirement. So, you have to decide what kind of problems he has, and then accordingly the person could be identified and referred for the counseling process, and then the treatment starts. Okay. This is the most important stage where the person is being counseled to solve the problem, right. And then it could be done in group. Basically, if you look at the all these which is done by the counseling, it is basically the basic approach is what you call the you are using certain psychological process to understand his problem, okay, and that is where you are going to use group therapy. You ask him to go for medications, that is done by psychiatrists, not by counselors. You can individually coach and counsel him, or you are using certain behavior therapies as proposed by the psychologists, right. So, there could be different kind of intervention mechanism. Here we are not going to discuss different kind of intervention mechanism, but because it goes beyond the scope of the course, but what we are going to discuss here is that the treatment has to be given to the individual depending upon the requirement. So, suppose he is alcoholics, then he has to go to a rehabilitation center. If he is depressed, then he has to see a counselor, and the counselor will try to find out the reason, and then he will suggest certain appropriate actions that is to be followed up by the counseling or the person who has a problem. Okay. So, the approach is going to be different, and most cases it is behavior based, because counselors do not prescribe medicines. So, all these therapies are behavior based, where they try to bring about a change in behavior by identifying the reason, identifying different solutions or options that could be taken up, and then making aware that if you do this, probably this kind of problem is not going to happen, right. And then you go for follow up. In follow up, what actually happens? You try to see that the person does not go back to the same kind of thing. In many cases, it has been found that if you go for this kind of mental health issues, mental health issues, where you have been treated for say mental health, say for depression, okay. You have overcome the depression, but after some time it recurs back, and then you again get into the depression, maybe for a different reason, right. So, it is the responsibility of the HRD professional and counselor together, and keeping line management loop, to ensure that he is being monitored over a period of time, to ensure that these things are not going to happen again, right. So, follow up is very much required. So, you ensure that employee is carrying out the treatment on a regular basis, you are getting important information related to his progress, and make sure that referrals and treatment are very effective, so that person comes back to the track. So, this is a caution about employee counseling that we need to discuss here, that is, see, it is not necessary that you go through all the 6 approaches that we have discussed, starting with problem identification to referral. Okay. It depends upon the requirement, right. So, you have to see that what are the problems, what is the appropriate response, and what are the resources that is available, and accordingly decide what would be the steps that you are going to take related to the counseling. Okay. Thank you very much.